First of all, we've stood here many times and said that testing and tracing is an incredibly important part of identifying people who are sick, getting our arms around their close contacts, and then helping both of those groups isolate. And that's been what we've been doing for the past couple of months, and it's turned out to be a pretty effective way to connect with people and to help them stay isolated. And I think that's got to be part of the strategy going forward. Now, no one really knows what's going to happen in the fall, okay? In fact, we're going to talk to the Medical Advisory Board about that, aren't we? But there are plenty of people in the infectious disease world and the epidemiology community who say that pandemics like this have an echo. And the echo typically shows up in the fall. And we've talked to our colleagues in the healthcare community about how they and we should be thinking about this. And I absolutely believe that one way you reduce the size of the problem you have in the fall is by doing everything you can to squeeze as much of the heat out of the virus as you possibly can between now and then. And at the same time, as we said before, as we move forward on reopening and as more people are in more contact with one another, in addition to people continuing to do the things they need to do around masks and distancing and everything else, we need to continue to enhance our capacity to test, especially with vulnerable populations and high contact communities, and make sure that testing is not an obstacle for people, and then use the tracing program to do everything we can to manage whatever the isolation issues that people have. I think this is sort of part of a coordinated approach to maintaining the success that people have had over the past few months here, so that as we roll through the summer, we continue to carefully reopen, and we get to the fall, we're as well positioned as we possibly can be to work through what everybody says potentially is an echo.
So it's a safety, you're worried about the fall, so you want this excess, what would appear to be excess capacity to deal with something if it materializes?
I think the one thing I know about this is when this happened in February and March, there was scarcity on everything. There was scarcity on testing, there was scarcity on PPE, there was scarcity on data, there was scarcity on healthcare capacity, there was scarcity on infection control protocols and capabilities, and we writ large, paid an enormous price as a state and as a country and as a globe for not being prepared. And we're not going to be caught by surprise in the fall.